Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Okay, the Hangout on Air is now live. If that's true, then hey, everybody, and welcome to another edition of Research Perch, your Massage Therapy Foundation podcast, bringing you information and breaking down articles about massage therapy research in a way that we hope you can use and that will really enrich your life and your practice and your profession. Today, I am representing the Massage Therapy Foundation end of the Research Perch discussion solo because Geraldine couldn't be here, my partner in crime. I'm Ruth Werner. I'm a past president of the Massage Therapy Foundation, and it is my very great honor to welcome our guest to Research Perch today, and that is Dr. Nina Sharif Franklin. And I'm going to have her introduce herself in a moment, but I just want to let our listeners know that Dr. Franklin is the author of the article that we're talking about today, which was based on some research conducted several years ago, or 3 or 4 years ago anyway, right? 3 years ago?
Three.
Yeah. Since then, Dr. Franklin has continued to build her relationship with the Massage Therapy Foundation, and in the interest of full disclosure, I'd like to let everybody know that she currently sits on our board of trustees, but all of that happened long after this article came to pass. So with that, Dr. Franklin, would you like to give us a little bit of information about who you are and what you do and your background, and also what led you to be interested in massage therapy research?
Okay. Well, I am Nina Sharif Franklin, as was said, and I'm a research scientist, a lifestyle strategist, and have over 15 years of experience in academic experience, practical experience, clinical experience, all over the place, industry, in health and wellness and physical fitness and rehabilitation in general. I've also been a clinical massage therapist for 12 years now. And since I entered school, I've been interested in helping to expand and improve the scope of massage therapy research, specifically within the prevention and wellness realm, because we often talk about, the clinical aspects or the wellness aspects. But I kind of want to know, how does massage mesh with other healthy lifestyle behaviors, good nutrition, exercise to make real change?
So the project that we're going to talk about today is one that will be especially interested for anyone interested in the interface between massage and exercise science. And I'd like to talk a tiny bit just to get us set up in this, because this is, of the realm of things that we talk about on Research Perch, this one is really on the technical end. There's a lot of, there's some math in this one that we don't have to go into. Because we have Dr. Franklin here. But what I want to let our listeners know is if you're like me and you have been a teacher of massage therapy, you get stuck on this statement about massage therapy and circulation, right? We have this idea that massage boosts circulation, or that massage helps circulation in some way. When I went to school, I was told, a 60-minute massage is the same as a 10-mile hike or something like that. Or massage boosts circulation by 300%. I still see that written down sometimes. And as a teacher and as someone who's trying to get picky about how we put language around our work, that drives me a little crazy, because circulation can mean so many different things. And one of the things this study did was begin to look at, what does that mean, massage and circulation, and to choose a thing about circulation to really look at. And what you chose is something that a lot of us wouldn't think of, which is the function of our endothelium. So now I'm going to put on a little bit of anatomy review hat. This is our anatomy bobblehead. Oh yes, endothelium, I remember that. So endothelium is, as we will recall, the inner lining of our blood vessels. We have some of us have an idea that all it is a barrier between the circulatory system and the interstitial areas, but that turns out not to be true. Endothelial cells are extremely bioactive and respond to all kinds of changes in order to help us maintain that stable internal environment, that thing that we call homeostasis. And what Dr. Franklin and her group did was look for ways of measuring endothelial function, and it turns out there's a way to do that with this test called flow-mediated dilation that I'll have Dr. Franklin describe. And then she and her team asked, does massage have any impact on this measure, flow-mediated dilation? And by that, can we say massage has some kind of impact on endothelium activity and endothelial health, particularly in the context of people who have overworked their muscles? So you begin with this concept of exercise-induced muscle injury, and you got some wonderful volunteers to allow you to overwork them, and then test massage and this measure of endothelial function. So I'm going to set it up just that far, and Nina, now I'll invite you to talk us through sort of your methods and structure of what this experiment really looked like.
Okay, so you did a fine job of breaking down a whole lot of information so that I don't have to explain it once again for the sake of the study. So basically, we took sedentary adults. I should say that our former research showed that individuals who were sedentary responded to exercise as some individuals who actually have cardiovascular disease in terms of their endothelial dysfunction. So sedentary lifestyle is a real risk factor. So we took a group of sedentary adults who were otherwise healthy. So after no presence of any disease conditions, the ones we know, cardiovascular disease, diabetes, etc. And we had them to exercise their legs to soreness using a standard leg press machine that's seen in gyms. And to soreness, I mean 6 to 8 sets, 10 repetitions, and these things were heavy. So this was eccentric exercise also, which is known to induce the most muscle soreness or muscle damage. So after this, half the exercisers, I'm talking about the exercisers only because we had 3 groups. One group didn't exercise. But half of the exercisers received traditional Swedish massage after the exercise.
And that massage was only to their legs and
yes, to the lower extremities, only to the lower extremities. So the exercise was lower extremities, and the massage that followed for that group was lower extremity. And we asked these participants to actually rate their level of soreness before the exercise and or massage, and then later afterwards at different phases on a scale of 1 to 10.
Let's just back up just for a moment. So right now I have this in my mind, this picture of a bunch of people in a gym, doing leg presses.
Yeah. Mm-hmm.
Can you give us a breakdown? How many people did we have, and what were the 3 groups?
Yes. So the 3 groups were the exercise and massage group. So that was an exercise group that received massage after the exercise. The exercise only group, they exercised, did not receive a massage. They rested.
Cool. That's no fun.
It was probably the group that was the most unhappy of the whole study. And then we had a 3rd group that was the massage only group. So they basically rested for 30 minutes during the time that the exercisers would have been exercising. And then they received a massage. The massage was 30 minutes. The exercise bout was 30 minutes. So the timing evened out at the end. And just a little 60 minutes later or a little after, they received their second treatment, which I'll talk about in a second. So basically, these 3 groups were groups of 12. So we had 36 participants in some. Not the largest sample size, but for the robust nature of this study, it was the assessments for this study, it was pretty significant there in size.
All right. So we've got these 3 groups.
Yes.
So the exercise only, exercise plus massage only. We did not have a group that got nothing.
Yes, no pure control group. That was definitely a limitation of this study. But if you follow massage therapy research in general, it's very difficult to that sole control group for a variety of reasons.
Hard to get people to stay in the study, among other things.
Yes, that's a big one. And when you think about the magnitude of the assessments, we kind of know nothing will happen of significance. So we considered these soft control groups. So the exercise only group was considered a soft control, and the massage only group was considered a soft control.
And so can you tell us, please, just, with understanding that you're talking to non-chemists and non-physicists.
Absolutely.
What you measured and how that connected to your hypothesis?
Yeah. So again, we have we have the general soreness measurement that we take, and that I'm sure you've seen. So we assess the quadricep soreness by. I'm sorry.
Was that a scale of 1 to 10?
Yes, that was on a scale of 10. So that was the first. That was not the primary. It was definitely a secondary measurement. But our primary measurement was endothelial dysfunction by way of an impaired FMD response. So I'm going to state it simply, non-technical. Basically, this measurement involves a blood pressure cuff inflation. So just like when you're getting your blood pressure measured, we inflate a blood pressure cuff for a period of 5 minutes. And this is designed to produce an adequate hyperemia to allow for flow-mediated dilation. So flow-mediated dilation is actually a relaxation of the smooth muscle cells. So you know those 3 layers of the artery, the endothelium, the smooth muscle cells, and then you have that external layer. The endothelium actually, when you have a hyperemic response, as I just described, where the blood flow increases, it actually triggers the nitric oxide is a vasodilator. So that's something that is triggered to widen the blood vessel. That actually triggers a response from nitric oxide. And ultimately, smooth muscle cells relax, artery opens wide to accommodate the blood flow. So we measure, that is the measurement. Now, if you have impaired endothelial function, the FMD response will be lower. So the dilation will be much lower than if you have an enhanced response. A normal response is for the diameter to increase. With exercise, a normal response would be for it to increase or change, slightly depending on the disease condition. It will not stay the same. And a normal response is oftentimes an impairment.
Okay. So one of the things that I learned from this, and we've talked about this before, is there's sort of a difference in the endothelial health of people who exercise who are already active and fit.
Yes.
Versus people who exercise who are typically really sedentary.
Exactly. And so what we've shown for previous studies in the lab, and we've done a lot of them, we've compared individuals who were sedentary to individuals who were fit, and even to a certain extent, individuals who weightlifted versus individuals who ran, engaged in more aerobic types of activities. And we showed the most enhanced response among weightlifters often. And among sedentary individuals, sometimes there is no change in the diameter, no significant change in FMD, I should say, or oftentimes even a decrease. And that's consistent with the normal response of some individuals who have cardiovascular disease and related disorders. So I want to clarify this because I took this note that one of the purposes of this measurement, FMD, flow-mediated dilation,
is it sometimes used as a predictor or a factor in identifying risk for cardiovascular disease?
It is. It's a standard measure of general vascular health. Now, where it's not a metric that's used in hospital settings like your blood pressure. It's not a common method used as of yet, but the method is used when we're further assessing the risk of atherosclerotic disease in research settings. And some settings also, some medical settings also perform it on the coronary artery versus the brachial artery, which is the artery we use. So it is used, but not widely used in medical settings. Okay. And I do also want to add that our previous studies have actually shown that exercise-induced muscle soreness can substantially reduce this response too. So this is something that served as a segue into this particular study. And I say that because if you think about the risk of cardiovascular events with acute exercise, strenuous exercise among individuals at risk, this is significant from that standpoint as well. The person who around this time of year decides they want to lose weight, January 1st, they go to the gym after having not working out at all, and then they have a cardiovascular event. So there's a link between strenuous exercise and risk, and that's something that we assessed here.
And so it's something that FMD, flow-mediated dilation.
Yeah, that's that flow-mediated dilation. It's
Okay.
actually a really cool tool.
So it's this blood pressure cuff, and then there's an ultrasound machine involved as well.
There's an ultrasound machine. Looks like a standard ultrasound, like the readouts you would see in a maternal ultrasound. Looks a little different, obviously, because we're looking at an artery close to the womb. But it's actually, you can see changes in blood. You can actually see, and many times with the naked eye, there's a significant change. You can see that artery widen as that blood flows through after we release the cuff.
So the hypothesis then was, I wrote this down to make sure I've got it right. Oh, so you had two hypotheses running into this. One is, does exercise-induced muscle injury at the leg or the lower extremity impact flow-mediated dilation at the arm?
Yes.
And then the second hypothesis is, does massage at the leg, in relation either with exercise or without, also impact flow-mediated dilation at the arm?
Yes, that's correct.
Right. And so what did you find out?
So basically, I just want to clarify too, because this is information that's necessary for saying what we found out in the end. It was not a significant hypothesis there, but there was a duration effect that we wanted to see, given that the symptoms of delayed onset muscle soreness or muscle injury, et cetera, tend to peak between 24 and 72 hours. We actually measured FMD in the upper limb, as you said, 90 minutes after, so right after, 24 hours, 48 hours, and 72 hours after. So we looked at this effect across time. And I don't know if you want to show the results now.
I will, if you would you like me to bring up that chart?
Yeah, I think it would help.
I will do my very best. So
okay.
Just a moment. All right, I'm going to screen share. This is for our listeners. This is incredibly scary. Application window. And this is the application that I want. And I'm sharing. And can you see it?
Yes.
Yay. Here, I'll see if I can make it bigger. No, it doesn't look like it's going to get bigger.
That's okay. I can kind of, see. I see the visual. That's I see the visual there, so I can wing it. So it's small, but it's also in the paper, which is available. But
right. It's available free full text, by the way, and we'll have the link for that when we edit this podcast.
Yeah. So looking at that, you see the closed circles. That will be our main experimental group, the group that exercised and then received the massage. And you're looking at the open circles. That is the soft control number 1, the individuals who exercised only. And then finally, the inverted triangle, that is the massage only group. So for the exercise and massage group, FMD indicated improved blood flow at all of the time points. So this is
better.
Yes, it's great. Absolutely. And I must point out with the daggers that this is a within group change. So it does not denote significance between the other groups, meaning the individuals, they had responses that were altered, but not necessarily different from the responses of the soft control group. I should say significantly. We're looking at it and there is an obvious difference there, but meeting the level of significance is what I'm referring to. As we expected, and this is based on our previous studies, the exercise-only group showed a reduction in blood flow after 90 minutes and 24 hours and 48 hours as well. And so this is very consistent with what we see within groups in our studies of sedentary individuals in the absence of massage. And it did return to normal levels at 72 hours. So, like I said, pretty consistent. Now, based on this information, based on this information, there's clearly a difference between the individuals who received massage and the individuals who did not, even though it did not reach significance. And if we go into the other group, our soft control group, the massage only group, there was a notable increase there. And this was actually a response that we did not expect. We just did not expect it. There was no exercise component. There was really nothing but a massage treatment on a group of people who were not sore at all. And that response was enhanced. Once again, we're looking at a peak per the dagger at 90 minutes. But if you see the stars above that particular measurement, that actually showed a significant difference at those 3 time points, the 90-minute, 24-hour, and 48-hour time points between the 2 soft controls, the EMI only, that's the exercise only, and the massage therapy only. That is very compelling because that is showing that somewhere between exercising only and receiving a massage, there was some normalization of the response. Although we didn't have significance in that middle mark, it's actually consistent with a normalized response, meaning if that EMI group, that main experimental group with the closed circles, did not receive a massage, there is a chance, a strong possibility that their response would have been very similar to that exercise-only group. Whereas that massage group, that was just a sheer effect of massage that had nothing to do with a response or tapering of soreness or injury, but a pure effect of massage therapy on FMD.
So this is where if we had a 4th group that got nothing.
Yes, would have been very powerful.
we would expect that line to go more or less straight across. Is that correct?
Yes, exactly.
Right. Okay. And so, I know that there's a big difference between statistical significance and clinical significance. And what you're saying is it did not achieve the level of statistical significance, but it made a big difference for the individuals who were involved, right?
Absolutely. And it was,
especially with reports of pain.
And there was significant difference within the individual. So I want to point out there was even statistical significance within groups. So that's basically saying Ruth goes and she gets a massage, and her results alone, they improve.
Right. Right. So that's an example of clinical significance.
Yes.
So if you wanted to, if it were possible for you to give our listeners a 1 or 2 sentence takeaway based on this result, before we start talking about pain, and based on this result about what we see about massage in the arm, the leg, and what this tells us about systemic endothelial responses, what can you tell us?
So FMD in and of itself is a systemic measurement, meaning it's a brachial artery measurement, and we're basically forming conclusions about the vascular system through that specific measurement. So if FMD
I'm sorry, Nina, I need to interrupt because I think I just misspoke. The massage was to the leg, but the measurements were in the arm.
Yes.
So as you say, we did this measurement in the brachial artery after injury and massage to the leg.
Yes. And so the fact that there was actually a change in upper extremity FMD, because there is a lower extremity FMD as well that you can perform in the popliteal artery. But given that there's a change in FMD from a lower extremity treatment, it is indicative of a systemic response. And based on these studies taken alone, it is definitely a belief or a possibility that massage therapy could somehow improve circulation overall in a beneficial way. And again, I want to emphasize, we're talking one treatment, not a treatment at 90 minutes, 72 or 24 and 48 and 72. We're talking about one treatment with a duration effect.
Right.
And that effect is definitely systemic.
On one massage. And when you say improved circulation, let me just ask if what you mean is improved endothelial function.
Yes. I should say, and let me clarify, because that was quite a generalization if you take it wrong, but definitely improve endothelial function, and possibly through improvements in endothelial function, enhance circulation. Because once again, if endothelial dysfunction is improved, that is a result on changes in normal blood flow due to the way the arteries respond to stresses.
Right.
And stresses meaning exercise, stresses meaning, anything that taxes the circulatory system.
So I'm going to stop screen sharing here. Good. So good. So the takeaway that we get from that chart is we have some pretty good indication that massage has an impact on systemic endothelial function.
Yes,
a
absolutely.
positive impact on systemic endothelial function.
Mm-hmm.
An issue we have not really emphasized because this study wasn't really looking at it, but there is a link between poor endothelial function and a risk for cardiovascular event.
Yeah.
So, we could really sort of torture this finding and say at least it lets us ask questions about massage and the risk of cardiovascular disease. That would be a much bigger, harder thing to study, but it
we
opens
got a long way to go. We got a long way to go for that.
And so, okay, but so let's come back to our people in the lab who have hurt their legs for you, and let's talk about their pain scores.
Yes. So basically, I have to pull that table up myself. I do. Well, I think I remember. Actually, I remember. I don't have that table in front of me now, but
find it. So I'm going to let you talk, and I'm going to see if I can find that table.
Well, I will say that, and we'll verify it if that table is found. But I will say that the exercise only group, right again on that scale from 1 to 10, their measurement for delayed onset muscle soreness, I know was in and around 8.8 on the scale from 1 to 10, that's pretty significant soreness.
That's a lot of pain in their quads.
Yeah. And that was taken at the peak level of soreness. So that was when it was the highest. And again, there is standard error within that zone, but it was 8.8 on that number. And then the individuals who experienced that massage therapy treatment after exercise, actually, I know it was in and around 5, maybe 5.3 if I'm a betting woman. Somewhere in and of, without the table in front of me, I think that'll be pretty good, a pretty good guesstimate there. And then of course, the group who received the massage only had no sort of pain or soreness whatsoever. So they were pretty low on there. And that definitely, those results were significant across groups. So there was definitely an effect on both statistically and clinically on that delayed onset muscle soreness.
Right. So we're in this conversation, we are mixing together this concept of exercise-induced injury, EMI, and delayed onset muscle soreness, because really it's one leads to the other. Right? Did I lose you? Oh, Nina, I hope I haven't lost you.
I just lost you for 1 second.
No, I can hear you.
Okay.
Yeah. All right. So we're putting together this exercise-induced delayed onset muscle soreness as sort of, this phenomenon that goes together, right?
Mm-hmm.
Right. Okay. Good. So I want to emphasize for our listeners a couple of things. One is these really fascinating findings were based on a single 30-minute massage.
Yeah.
And so I have written some discussion questions that we will put up with this research perch when it gets published. I don't want to risk losing Nina now to dig them up on my screen. But, among the questions I have are things like, what would happen if it were someone who got, for instance, you get better at receiving massage. People tend to get more effect out of the same treatments over time because their body sort of gets better at adapting to that. So that would be an interesting thing. And another interesting question would be, what if these weren't sedentary people? What if they were active athletes? Mm-hmm. And what kinds of changes what might we expect to see? Mm-hmm. And also, I'm really curious to know if how much people think it's a stretch to say if we can show evidence that massage improves flow mediated dilation, isn't that a suggestion then that massage improves cardiovascular health or endothelial health and the ability maybe to resist things like making unnecessary blood clots or reducing overall inflammation and things like that? So it's a thought. So Nina, this article was published in the Archives of Physician. It's ArcPhys Med Rehabil. Can you what the name of the journal is? Archives of Physical Medicine and Rehabilitation. And rehabilitation. Thanks.
Yeah.
And it was published in 2014. And it is available free full text. And how did you get grant? How did you put together the financial investment that it took to do this study?
Well, it's my pleasure to say that the Massage Therapy Foundation was the primary source of funding for this particular study. And this is how I've grown, well, not just because of my funding, but I've grown to love this organization that I'm a part of, because getting those funds together really put together robust research studies. So it was a great deal of funding from there, and this funding was combined with funds from the National Heart, Lung, and Blood Institute, which is a part of NIH, based on a fellowship that I received as part of my PhD studies when I was in candidacy. Which is when I carried out this particular study with my group. And my mentor, who served as senior author for this particular study, helped out a great deal. He had curiosity about these effects himself, and we really just went on in and did everything we could. And there are more results to come. So that's the beautiful thing. That shows you how far research dollars can go.
Right. So do you have plans in mind for building on these findings?
Well, I do have plans of revealing more findings first, because they're already done. It's just a matter of publishing and, getting it out to the mainstream. But I have not ruled out the possibility of using this data as pilot data to go after a larger scale study, because again, there's power in numbers, and the study is laid out in a very repeatable way. And so I'm also curious to know, based on that massage therapy only response, once again, which we didn't expect, what more can massage do when it comes to FMD? And the fact that it was a 30-minute treatment is very compelling. And I think it's far-fetched, once again, based on a smaller scale study, to say that we can, do these magical things with massage, mainly because I'm an exercise physiologist alone too. And I wouldn't want people saying, oh, it replaces exercise. But it's definitely
it makes us wonder. So.
Yeah. The results definitely could support that there are changes that happen with athletes, with exercise, post-exercise, and changes that are definitely worth looking into. So there are a lot of different ways we can go with this research in the future.
Thrilled about it, and I'm really proud that the foundation saw that potential. And I love when branches of the NIH get involved in massage therapy research, especially when it's outside the National Centers for Integrative Health, which is a wonderful resource for massage therapy research as well. But to get inroads into these other branches of the NIH is I think, really a smart idea for the profession. Mm-hmm. So I want to thank you so much for your research, and I want to invite listeners or watchers to contact us with comments or with questions for Dr. Franklin. When we publish this, I'll make sure that you have contact information for Dr. Franklin's blog about lifestyle strategies, and also the discussion questions that I've put together to take this back to your classes, your meetup groups, and whatever peers your journal clubs, whoever it is that you talk about things like this with. So on behalf of the foundation and on behalf of Research Perch, Dr. Franklin, thank you so much for being with us today.
Thank you. My pleasure.
All right. We'll see you next time.
All right.
Bye-bye.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.